Good morning, afternoon, evening, everyone, and welcome to day two of Research and Health Innovation Summit 2025. I'm Shikha and I'm thrilled to have you guys back for another exciting day of discussion. We hope everybody in the audience enjoyed if you've joined us day one, and we are ready for an even more valuable insight day today. To kick off things, I'd like to hand it over to Dr. Purav, who's the CEO of Healthark, who will reflect on day one, covering the key takeaways and lessons learned. After that, Julie Krommenhoek, co-chair of the summit and strategic and key advisor for life science companies, will guide us through the exciting agenda for day two. So let's welcome Dr. Purav Gandhi.
Thank you, Shikha, and good morning, afternoon, evening, everyone, depending on wherever in the world you are. Welcome to day two of the RWEsearch and Health Innovation Summit. We had a fantastic action-packed day yesterday. As I reflect back on the discussions yesterday, one of the key discussion topics we had was the role of India in driving health innovation around the world. And we talked about two parts, right? India for India. What is the healthcare transformation happening in India? And perhaps it's one of the largest healthcare transformation in the world right now. As we look at the number of people going from being uninsured to number of people being insured, it's probably the largest insurance coverage in the world. A lot of technology driven changes and data driven changes are driving this transformation at a rapid pace. There are very valuable lessons coming out of this. But also, in parallel, there's a second transformation happening where India is contributing to the world in terms of driving health innovation through the global capability centers that are being set up and scaling at a rapid pace. 10, 15 years ago, India used to be a cost arbitrage center, but it's no longer the case. We looked at probably like 9 out of 10 top 10 life sciences companies and more than 30 out of 50 top life sciences companies have a global capability center in India, which is not focusing on cost arbitrage, but being a driver of innovation and driver of change. And through AI, this change is happening at an unprecedented pace. We also talked about a lot of other transformations happening in the field of RWE. We heard from Brett Davis, Chief Innovation Officer at Deloitte, about the RWE survey and the rapid pace at which real-world evidence is being adopted globally, especially in last 12 months, how that pace has significantly increased given the introduction of Gen AI, not at a proof of concept stage, but more at an adoption level. So a lot of interesting trends converging. Yesterday was just the beginning. There's still a lot more to be discussed. As we were planning for today, we looked at the number of discussions today. Today is the most action-packed day. The number of panels, the number of experts from different parts of the world coming together. It's going to be an amazing day. Without further ado, I would like to hand it over to Julie Krommenhoek, who's been the co-chair for this event. She has helped us kind of curate every single panel, the type of speakers and experts we bring. How do we ensure that we derive most out of these discussions? So she'll tell us about what's in store for today as we kick off day two for this event. Over to you, Julie.
Thanks, Purav. Thank you, first of all, for setting the stage like that. It is a big day today. I loved yesterday and all the recap that you gave. Again, I'm Julie Krommenhoek. I'm the very proud co-chair of RWEsearch and Health Innovation 2025. I'm thrilled to guide you through day two. And we're gathered to continue what was already discussed, which was the RWE topics from yesterday. And then today I kind of consider it a stir-up day for some urgent, old, and inspiring new RWE topics. So before we dive in, I, like Purav, like to reflect on last year's conference. And one of the key learnings that we, or the Healthark team, really carried forward was the importance of creating space for the panel discussions. What we noticed is that sometimes you don't get to attend all the world, discussions and really get to see on stage who is, in the middle of those amazing topics. So what I love is when you get to see all the challenges that happen and the diversity of perspectives and expand the range of those themes, which is exactly what happened this year. I remember one participant from last year, Purav, I don't know if you remember, that said the real value in this conference is the dialogue, not so much the monologue. And that doesn't say anything about the speakers. The speakers were absolutely wonderful, but it shows you how much learning gets done when you actually have the people kind of moving in together and thinking about the key topics. So these reflections are at the heart of what Healthark's team has shaped this year's program and is really built in time for rich topics. And so I guess more than anything, we want to give you, the audience, the experience that you asked for. So today we'll focus on two critical themes. The first theme is diversity in clinical trials. That was discussed a little bit yesterday, and also diversity. It's the top topic, hottest topic, heard in nearly every conference, summit, roundtable, and event for the past decade. And the urgency of this slightly older topic just keeps getting louder and louder. And thankfully it is. Because as we all know, historically, if you've been in the clinical trial space, you've known that there's been a lot of populations that have been excluded and dramatically underrepresented in our patient population, which, as we know, when we talk about it in an RWE sense, it's leading to major gaps in the data, and that affects the applicability of the treatment. So ultimately, it does affect us all. I believe that it was Beth Brooks. You might have to check me on this, Purav, but Beth Brooks reminded us last year that most of the data that we're still using today is based on insurance claims. It's based on old, outdated data sources, leaving out a significant portion of the uninsured and currently underrepresented. So we really need to capture more diverse and complete data to better represent those vulnerable groups. So thanks to Beth and the team from last year, we have made great progress in making our voices known, and we've heard it, continue with other seminars and sessions and roundtables. So if you don't include the people making up our world, is really what we're saying, we certainly risk building solutions that fail the very people that we're trying to treat most. And as Purav mentioned earlier, adding more diversity and more means and more data sources that have that diverse clinical trial population, it will ensure new treatments and innovations are safer and effective for all the populations around the globe. So in today's sessions, we will dig into the heart of the diversity topic, not only describing why it matters, so I think we kind of have covered that, but what we'll talk about is the current examples of the progress that we've made, and then what kind of future lens do we see happening when we make trials more inclusive. So our goal will be to advocate and carry our voices forward on real-world data, because real-world data must reflect real world, or it's not real. So after raising our voices on diversity, we will turn our attention to one of the greatest catalysts of our time. The second theme will be validating fit-for-purpose data in an era of AI. Artificial intelligence, as we all know, is transforming everywhere. Healthcare is just one slice of it, but from early detection, imaging, diagnostics, drug discovery, all the way through commercialization and regulatory, it is shaping us. So some estimates suggest that not only is it shaping how we do things and how fast we can get things done, it's also a cost savings, because it could save, we're hearing right now, just in the US alone, about $150 billion by the end of 2026, if it's used wisely and appropriately. And we know that that number would double if it looks globally. So we all know the saying that AI is only as good as the data behind it. But right now, we're kind of hearing something a little different. We're hearing that now we're growing into a market where that cost savings is becoming something that healthcare leaders are looking at seriously. And we did do a poll, and 60% of the healthcare leaders, not only with us today, but in our network, do worry about the AI, that it might have bias. So because the data, and their number one reason is they believe that the data might be incomplete, it might be underrepresentative, it might be outdated, it might be recycling and lingering old processes and not be as cutting edge as we think it is. And I guess that's exactly what leads us to our topics that we're going to cover today, which is kind of the human versus machine conversation, because AI alone doesn't solve the bias. We know that. Humans bring the content, clinicians bring the judgment, and patients bring that living experience. So when we connect those, it really does turn into a real world evidence type of machine. And so when we're using those and linking those, it's much more than just an algorithm. It becomes a powerful partner and a use case for us. So the real promise of the next era is human intelligence plus artificial intelligence, well-grounded in real world data. So today, across all the sessions, you're going to hear top experts, leaders, thought leaders, and people from all different trades that are innovators that are sharing how they're tackling and how their nervousness and how they're tackling the bias. And they're also learning to build trust. And they're making that AI clinically meaningful case study for themselves. So I know we have a lot of inspiration ahead with keynotes, expert panels, and plenty of time to talk about real dialogue. So whether you're a physician, a provider, a student, a policymaker, technologist, data scientist, we hope that you leave today with fresh insights on how to make healthcare more inclusive, more evidence-driven, and more impactful. And all we ask is please stay engaged and please really heighten your level of participation and reactions. So I'll leave you with that, and thank you all for joining us for a great day 2. And I'll pass it to our amazing host, Shika, to kick off our sessions, and look forward to seeing you again.
Thank you. Thank you so much, Julie, for setting the stage for day 2. Like Julie said, 2 very, very important themes, diversity in clinical data and trials and fit for purpose data. These are 2 topics which we'll discuss in depth today. Also, as we start the day, I would like to take a moment to acknowledge 2 of our partners for this year, Real World Wednesdays, which is one of the leading podcasts in the life sciences industry, probably the leading podcast in the field of real world evidence. We're partnering with them and we'll bring Real World Wednesday episode live today as a part of the conference. Also, this year we are partnering with ISPOR, which is probably the most reputed and influential body in the field of real world evidence. And we'll hear from the eSport leadership today during the sessions today. So looking forward to having an engaging day. Stay tuned for the first panel discussion starting in probably a couple of minutes.